Hello, my name is Dr. Varun Saxena, and I work with the Gastroenterology and Hepatology Department of Kaiser Permanente Medical Center. Welcome to our online class about healthy liver. We've created this class to inform you of an increasing health risk that causes damage to the liver. A very common liver problem is non-alcoholic fatty liver disease, or NAFLD. We're going to discuss how important this problem can be and what we can do to live normal and healthy lives. What does the liver do, and why is it important? The liver provides critical body functions. It filters the blood of toxins, makes fats and proteins, controls blood sugar, generates heat, stores vitamins, and helps the blood to clot. What is a fatty liver? A normal healthy liver is made up of liver and bile duct cells, but in a fatty liver, droplets of fat are deposited into the normal liver cells, altering their appearance overall and when examined under a microscope. When people develop a fatty liver because of problems related to their body's metabolism, this condition is called non-alcoholic fatty liver disease. In non-alcoholic fatty liver disease, excess body fat leads to problems with the body's normal metabolism and a cluster of conditions called metabolic syndrome. This can include increased blood pressure, high blood sugar, excess body fat, especially around the waist, and abnormal cholesterol or triglyceride levels. Not only are people with metabolic syndrome at risk of developing NAFLD, but they are also at risk for heart disease, stroke, and diabetes. Metabolic syndrome is very common and occurs in 1 in 3 adults in the United States. Why do we call it non-alcoholic fatty liver disease? It has been recognized for some time now that excessive alcohol consumption can cause liver damage and fat deposits in the liver. Excessive alcohol consumption is typically defined as 7 or more standard drinks in a week for women and 14 or more standard drinks in a week for men. Yet, in some people who do not drink heavily, they still go on to develop fat in their livers. Rather than alcohol as a cause of their fatty liver, they have dysfunction of their metabolism as the cause of their fatty liver. We call this non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a very common problem in the United States and worldwide, affecting approximately 25% of the general population. Worldwide rates of fatty liver have increased as more people have become obese and developed diabetes. So why does non-alcoholic fatty liver disease matter? The risk factors for non-alcoholic fatty liver disease are the same as those for heart disease, high blood pressure, and stroke. In fact, heart disease is the #1 cause of death in people with non-alcoholic fatty liver disease. People with non-alcoholic fatty liver disease have double the risk for heart disease compared to people without the condition. So when you take steps to treat non-alcoholic fatty liver disease, you are also reducing your risk of heart disease and premature death. A small number of patients with non-alcoholic fatty liver disease will possibly develop significant liver disease. When the liver is injured, it forms a scar, just like when you fall and scrape your knee. Over time, as the liver suffers from many repeated scrapes, more and more scar tissue accumulates and replaces healthy liver tissue. The degree of liver scarring can be measured on a scale from stage 0 to stage 4, where stage 0 to 1 is normal, and stage 4 is when the liver is completely scarred, also called cirrhosis. People with cirrhosis are at risk for life-threatening complications such as liver cancer and liver failure. Some people may need a liver transplant to survive. It is important to note that non-alcoholic fatty liver disease is just one cause of cirrhosis, and that some people may have more than one cause contributing to their liver scarring. Risk factors for developing liver scarring include weight gain, being overweight or obese, smoking, increased liver blood tests ALT and AST, and having diabetes. If your blood test results raise concerns that you could potentially have liver scarring, your doctor might order a specialized ultrasound called a fibroscan to further evaluate your liver. Fibroscan is a specialized ultrasound used to estimate scar tissue in the liver. If your testing shows that you are low risk for significant liver scarring, your primary care physician will continue to work with you closely. If your testing shows significant liver scarring, You might also be referred to speak with someone from the gastroenterology and hepatology department.
Are there treatments for non-alcoholic fatty liver disease? The main treatment for non-alcoholic fatty liver disease is healthy lifestyle change, which means changing the way you eat and move. Sustained weight loss is the main goal of treatment, as this directly addresses the main problem and is also the most effective therapy. The goal is not to lose all of your excess body fat, but to lose 7 to 10% of your total body weight permanently. Studies have shown that this can help with reducing liver fat, inflammation, and even scarring. So, for someone who weighs 220 pounds, he or she will aim to lose 22 pounds to make a positive improvement in his or her health. In some cases, individuals may have a normal weight for their particular height and still have fatty liver. This indicates that they carry too much of their weight as fat instead of muscle. Healthy eating plays an important role in weight loss and fatty liver. Healthy eating fundamentals include when to eat, what to eat, and how much to eat. For when, eat a meal or healthy snack at least every 4 to 5 hours and avoid binge eating. For what, choose a variety of foods from all food groups for a healthy balance. For how much, eat portions that are right for your weight and activity level and avoid overeating. Sustained healthy eating patterns play a key role in the loss of body fat, which, in turn, improves the health of your liver. This means making changes that you can continue for the rest of your life, instead of dieting, which is only temporarily successful. The two most important fundamentals for healthy eating are choosing the right type and quantity of fuel for your body. The optimal fuel, especially for those with fatty liver disease, is a high-fiber diet rich in whole fruits, vegetables, whole grains, beans, nuts, and seeds. Items such as animal meats, eggs, dairy, and highly processed foods should be kept to 1/4 of your plate if using the plate method, or mostly avoided for best health outcomes. For how much fuel, you can calculate an estimate of your caloric needs by using your weight and activity level with calculators offered online or by working closely with your doctor. Studies have suggested that exercise might help reduce non-alcoholic fat in the liver as well, although more research is needed to understand what exercises would work the best. In general, a combination of aerobic and strength training for a total of 3 hours per week will help increase muscle mass and decrease your body fat, which in turn improves the health of your liver, as previously discussed. There are currently no FDA-approved medications for fatty liver. At present, medications under development are not effective in over half of patients. You should talk to your doctor if you have not been able to lose weight and are interested in medications or bariatric surgery. At Kaiser Permanente, we have a number of resources to help you with your weight loss, ranging from group in-person classes to individual one-on-one counseling. We also have web-based resources that allow you to tailor your experience to fit your needs and preferences. Talk to your doctor about what option might work best for you.
Thank you for your time and attention.
If you have any other questions, please reach out to your doctor.